We had 5 individual EMRs spanning all of the service lines that we have. Collapsing those into a single EMR was a game changer. MEDITECH Expanse really allowed us to build a platform, a foundation for our affiliation to come together. Before that, we're disparate hospitals without a lot of interaction with each other, and definitely not shared information. Northwestern Healthcare is a group of 3 critical access hospitals and a home health agency trying to serve the population of Coos County. They were historically competitors, but then they moved into an environment out of sustainability to partner together. They came together. It's rather unique in healthcare these days because it does not include a tertiary affiliate.
Right out of the gate, we came together speaking the same language. And I say that most people outside of healthcare don't understand. There's really a difference between critical access hospitals and their operations and what they call PPS hospitals, larger organizations. We're paid differently by the government, and that makes a difference in how we plan our operations.
We're not beholden to anybody for the referrals. 100% of my time can be focused on quality outcomes, employee engagement, patient satisfaction, all of the things that really drive our key indicators. So this is really a story about 3 former hospital competitors coming together under a single system umbrella to share services rather than compete for them.
There's definitely a strong sense of community here. It's ingrained in everything that we do. Our patients, often if we have to send them to tertiary care for certain services, we try to take them back to do their skilled level nursing care here, and they're always saying that they're happy to be home because it's just a different feel here.
We are culturally different. We're north of the Notch. We are more rural, and I think it's really important. Every hospital is culturally different within our group, too.
Right.
So that's kind of amazing, you think of that. But it's working.
We have turned a corner in the last year alone, looking at data differently, not just graphs and charts to feel good about ourselves or stoplight reports and saying more green than red, fine. It's turning that into actionable items. What can we do about it? What have we done about it? Are the things that we think we're doing actually making a difference or not? So we started looking at data much more longitudinally. One of the things we're on as a system right now, we've embarked on our high reliability journey. And that's, I know a lot of consultants speak in buzzwords right now, but what it really means is just becoming relentless in the pursuit of perfection and the elimination of errors due to non-standardized work. We're literally trying to hardwire the best practices. So people do things the same way every time because we've proven with data that it's the best way to do it. It's not just, well, this was how I was trained and how did you do it and so forth. That's a harder row to hoe than you would think. It sounds easy, right? But getting people to change the behavior because I've always done it this way, well, but we can prove with data that there's a better way to do it. Let's hardwire that, make it easy to do the right thing.
Now with Expanse and having all 3 hospitals on the same medical record, it is 1,000 times better. When patients go to either of those hospitals, either of those ORs, either of those ERs, I can see what's in the chart when I see that patient, which makes care almost seamless. I can't stress enough how important it is for me working in the North Country and going to 3 different hospitals to have the same EMR, have all those patients getting the care that is in one place. So wherever they're seen in the North Country, it's seamless. You can see everything that's done, all the labs, any ER visits, any surgeries that might pertain to why they're seeing me.
Any system that allows you to have to search in less places to find information is going to cut down on your prep time and your time involved with each patient.
Point of care is especially helpful in the nursing staff to reduce steps and kind of coordinate their care a little better. So it's definitely important with medication paths, their assessments, their interviews with patients to identify what's needed at the bedside instead of having to go back and forth from the room to their standalone computer. So it definitely makes their workflow easier. It's definitely easy too if you're at the bedside and the provider's asking you, what were the labs? Did they come back yet? And you can pull them up on the screen and show them at the patient's bedside, which allows for better communication with the patient on kind of what to expect from their care. And so making sure that a patient has a great experience when they're here, they're getting all of their needs met, and it's nursing, working with providers, rehab staff, radiology, lab, you name it. Just making sure that everything's very well connected. And I would say that I'm pretty proud of the work we do here. We do a great job. MEDITECH has helped us to connect with others in primary care a little bit better, so we can pull medication lists, make sure that we're not making errors when a patient's admitted because they can't remember what they're taking. And it also encourages better communication with the providers that they see when they're not in the hospital.
I think the creativity is there. I think the ability to serve nearly all of our needs as a critical access hospital, most of them are within MEDITECH. It really enables us to be ready with the information at the fingertips of the decision makers when and where they need it, regardless of where they hit our system. Whether that's a primary care visit over in Lancaster or an ultrasound diagnostic up in Colebrook or an emergency room visit here in ABH, because we share that EMR and that philosophy that this is the patient record first, our providers are able to draw on that information and make the best clinically informed decisions they can. So I applaud MEDITECH for being flexible and being responsive and truly understanding what it is we need as kind of a mid-sized player in the healthcare market.